I'm Kirsty. I'm a registered dental hygienist and therapist here at Pure Periodontics and a lecturer in oral health sciences at the University of Essex. I feel working in dentistry is my vocation rather than my job. I love working with patients to improve their oral health, and I can't imagine working in any other profession. I love the positive impact we can have on a patient's self-esteem and confidence, and I'm always so pleased when patients achieve successful results from our treatments. At Pure Periodontics, our hygiene appointments are different to a general dental practice. We've taken time to make sure we've developed protocols that have an evidence base behind them and that we're following the latest guidelines. And we ensure that we listen to patients' concerns and then act on them and take our time. Airflow is the newest piece of equipment that we've got at the practice here. It uses a mix of fine powder and water and air to remove plaque biofilm from the tooth surface and to remove staining. And the newest powders that they use actually have an antimicrobial effect, and you can use it underneath the gum margin as well as on the tooth surface. So it means that the powder can reach much further than we can with our instruments, particularly into very difficult to access areas. So we can be sure we've removed all the biofilm to help the patient to maintain their oral health. We've noticed significant improvements with our patients when we're using it, particularly because it's so minimally invasive. So unlike with other dental treatments, once you have treatment for periodontal disease, you do require regular maintenance visits. You'll hear that called a supportive periodontal therapy, and the aim of that treatment is to support you over your lifetime to help you to keep your teeth. And the aim of the treatment is to keep the disease, or to stop the disease from reoccurring again, or if we do find an area where there's been some reoccurrence, to treat it quickly so we're limiting the damage that it causes. So we get a range of patients that have very mild disease to patients that need quite complex interventions. If you notice bleeding gums or sore gums or bad breath, it's really important not to ignore those symptoms and to get them checked out by your dentist or hygienist. Some patients will go to the chemist and buy a mouthwash or something they think might help, but actually there's an underlying condition that needs to be examined.